Welcome to Module 3, where we will talk about career development in genetic counseling. Genetic counseling is a rapidly growing field. There are over 5,600 genetic counselors certified by the American Board of Genetic Counseling in the United States and Canada. In 2020, the U.S. Bureau of Labor Statistics projected a growth rate of 21% for genetic counseling positions through 2029. Which is nearly triple the average growth rate across all sectors. The increased demand for genetic counselors is driven in part by the rapid advancements made in genetic testing technology and the need for qualified professionals to help individuals and families select and interpret genetic testing. High demand for genetic counselors means that employers are incentivized to offer competitive salaries and benefits. The diversification of roles and settings in which genetic counselors work also contributes to rapidly increasing job prospects for genetic counselors. Genetic counselors love their jobs. The National Society of Genetic Counselors, a professional network for genetic counselors from the United States and Canada, conducts a job satisfaction survey, and it found that 9 out of 10 genetic counselors are satisfied with their job. Genetic counselors are passionate about helping patients and medical professionals use genetic information to make informed decisions. Many genetic counselors count working in a cutting-edge field, having a competitive salary, having ample room for career advancement, and having the flexibility of diverse job responsibilities that can include patient-facing counseling, education, advocacy, and research, all among the reasons for being satisfied with their job. Competitive pay is also a source of job satisfaction. The median salary for a genetic counselor in 2020 was $97,900. In the US, and it ranged from $60,000 at the lower end to over $250,000 at the upper end annually. When many people are asked what a genetic counselor does, the common answers are, I don't know. And that's understandable for a small but growing field. Or they might associate genetic counseling with prenatal genetic testing, which is testing done during pregnancy that helps assess the health of the developing fetus, or the associated genetic counseling for infertility treatment, and that's because genetics can play a role in infertility, and fertility treatments like IVF or in vitro fertilization are a common procedure done to help couples who are trying to get pregnant. Traditionally, most genetic counselors did work in the prenatal or pediatric specialties, and many still do. However, genetic counseling is also expanding to other specialties where genetics are playing an increasing role. As a result of the rapid acceleration in available genetic testing that informs cancer predisposition and treatment, cancer genetics has become the largest specialty for genetic counselors. There are also many genetic counselors working in neurogenetics, cardiology, metabolic disease, general and adult genetics, and public health, to name the most common specialties. Research and laboratory roles are also increasingly common for genetic counselors, and among the laboratory roles, genetic counselors work both for clinical diagnostic laboratories and direct-to-consumer labs, such as those offering ancestry or genealogy services. About 90% of genetic counselors work full-time, but there is good flexibility for part-time work. And in states that offer licensure, genetic counselors may also be able to be self-employed, and that's because licensure allows a genetic counselor to order a genetic test for a patient without a physician's supervision. So where do genetic counselors work, you might ask? The answer to this question is also constantly growing and evolving, and it largely reflects the growth in the different specialties. Traditionally, genetic counselors often work in a hospital or outpatient genetics clinic. So this can include clinics that specialize in a particular disease or class of diseases, such as cystic fibrosis clinic or heritable blood conditions like a hemophilia clinic, or an outpatient clinic that specializes in a specific type of cancer, just to name a few. Many genetic counselors now additionally work for genetic testing laboratories, academic institutions and universities, nonprofits in a patient advocacy role, or government in a public health or policy role. Genetic counselors and their patients also benefit from providing care through multiple service delivery models. These include face-to-face counseling, telehealth, or telephonic counseling modalities. And many genetic counselors offer a mix of multiple modes of service delivery. Some genetic counselors, such as those working primarily in research, a laboratory setting, or insurance, may not have a direct patient-facing role, but instead help to provide genetic expertise for other medical professionals, policymakers, or private companies. A study from 2020 found that 95% of counselors who see patients offer in-person counseling, 36% offer telephonic counseling, 28% offer web-based telehealth, and 7% offer group counseling. You'll notice that these percentages add up to well over 100%, and that's because many genetic counselors offer multiple models of service delivery. Additional recent studies performed in light of the COVID-19 pandemic suggest an increase in the number of genetic counselors offering telehealth counseling. As a result of the mixed service delivery models like telehealth that are used today, genetic counseling has become more accessible, with over half of genetic counselors reporting that they can see new patients within 2 weeks, and 30% are able to see new patients within 1 to 3 days of referral. Efforts to diversify the field have also increased the number of genetic counselors offering counseling in more than one language. Medical interpreter services are also commonly used by genetic counselors to support the cultural and linguistic diversity of our communities. On this slide, you can find examples of the diverse roles that genetic counselors occupy, ranging from non-direct patient care roles in education and laboratory science to direct patient care roles, including direct patient care, clinical coordination, and supervision of genetic counselors in training. There are also many counselors who have a mixture of non-direct and direct patient care roles, such as with clinical coordination, administration, and research. 53% of genetic counselors report working in a direct patient care role, 25% in a non-direct patient care role, and 22% in a mixed patient care role. Setting of employment, counseling specialty, and job title all play a role in determining the extent of direct patient care, but there's a lot of flexibility here. Thank you for taking the time to learn about genetic counseling, career development, and the exciting changes in the field. For more info, please refer to our 4th module, Try It Out, where you'll get to do some first-hand exercises of what it's like to be a genetic counselor. I'd also refer you to the National Society of Genetic Counselors, or NSGC website, as this is a great resource for anyone who is interested in genetic counseling, or if you want to find a genetic counselor for yourself. This presentation was made possible by Monica Zak, Director of the Long Island University Post-Genetic Counseling Graduate Program, Dr. Heather Butts, Assistant Professor and Co-Director of the LIU Post Honors College, members of the Long Island University Post-Genetic Counseling Class of 2023, including myself, and information gathered from NSGC and BLS.gov. The presentation was made using SlidesGo, and we very much appreciate your interest in genetic counseling, and thank you for your time.